Good morning, everybody. It's Senator Curt VanderWall. Hopefully you're having a great day. Just kind of want to give you a few updates, what's going on, where we're at, what we're trying to work on during this time of the COVID-19 virus, which of course is taxing, testing, concerning. I guess we could go on with a whole bunch of different things that are going on. But I'll start off with a concern right now with not being able to get people back to work. It has caused a huge strain with the mental health side. And I just want to say, folks, if you see somebody that's struggling, a phone call, a reach out, some type of communication can go a long ways. For those that are feeling alone, struggling, nothing but depressed situation on Facebook and etc. The number below of you need some help. Please reach out. Big concern, and we need to make sure that not only do we try to get back to some normalcy through this virus, but we need to make sure that everybody's helped wherever we can. Second, the work group, the bipartisan work group that was put together by Majority Leader Shirkey is continued to meet. Excited to say that we also have a survey out for that, and we're just trying to gather information of what can be done. What do you think would be safe as an employee? What do you think would be safe as a employer? You'll see that site below. Please take a look at that. It'll be up for several days to garner information. Please take the time to look at that. Really important to us as a work group. As you know, I feel strongly that people in Michigan want to get back to work. And we felt that during this week. And there is, I'm going to say there's pressure on both sides. I get folks that say, we can't go back to work. And I also get folks that say, we must get back to work. I need to make money. I'm down to my last couple bucks, and they really do want to get out and do their job. Believe me, we do not want to put people back to work without safe work behavior. And I know that people say, well, it can't be done. It can be done. Other states around us are following the CISA guidelines. We're kind of an outlier. There are jobs that can be done and done safely. There's employers and employees both that are saying that these things can be done. We just need to make sure they are being done. So please don't try to judge me on that. We are looking to do what is right for the state, but we know that right now we're looking at a 30% budget shortfall, which means we're going to pay for this financially, business wise, also for the next several years. I've had several conversations with people over the week on personal protective equipment in our hospitals being short. So I started doing a bunch of research, and I just want to give you, this is 3 days of research. I've been calling every day to make sure. And what our hospitals have been doing is following the CDC guidelines. There's no break from that. So if the CDC is recommending this is what needs to take place, this is exactly what they're doing. So understand, we're not forcing people to do things that are illegal or not according to the CDC. Isolation gowns. Monday we had a 5-day supply. As of Tuesday, we jumped that to a 16-day supply. And as of last night, we're at an 18-day supply. Masks. Monday, we started at 24. These are N95 masks. Monday, we were at 24 days. Tuesday, 28 days. And we remained at 28 days yesterday. Gloves. We started at 17 days on Monday. Went to 19 on Tuesday. Finished the day on Wednesday with 21 days supply. Surgical mask. 8 days on Monday and Tuesday, 9 days of yesterday as of Wednesday. Face shields started at 20, went to 23, finished at 24 yesterday. So I did ask a question about ventilators. I said, where are we at on ventilators? I hear that there's a huge shortage. We're screaming out. Currently, statewide average is less than 50% of our ventilators are being used. We're sharing them through the state. So I just wanted to say, hey, you know what? The media always doesn't like to promote the positives. I think we've done a great job. As I talked to the governor's staff, she says that things have been working extremely well with FEMA. I'll get another update on that today from the governor and her staff on where we're sitting, but they feel that things are working to get to the 30-day supply, which is our goal. We're getting closer and closer every day, but the nice thing is we're seeing the numbers start to drop. So anyways, that's where we're at. I want to say thank you again for allowing me to be your state senator. And I know these are trying times, and folks, I appreciate it. I know that I don't make everybody happy, but we are doing our best to make sure that we move Michigan forward and work with our governor to get to those goals. So thanks again. Stay safe. Remember, social distance, personal protective, mask, mask, mask. Don't touch your face, your nose, or your eyes. Stay safe, and God bless.